everyone, welcome to my YouTube channel. In my previous video, I spoke about infertility. I spoke about the causes and factors that affect both male and female. I also spoke about attitude you should portray when you're around someone who is infertile. Some couples wonder how long should it take before they speak to their doctor about the condition. Well, most experts suggest it should be at least a year before they call the doctor. Women 35 years or older should see their doctor after 6 months of trying to conceive. A woman's chances of having a baby decreases rapidly every year after the age of 30. Women should speak with their doctors if they have any of these health problems: irregular or no menstrual period at all, painful period, endometriosis, pelvic inflammatory disease, and more than one miscarriage. It is very important you talk to your doctors before trying to get pregnant. This can answer questions on fertility and tips on conceiving. Now, to find out if a woman and a partner has fertility problem, doctors will do an infertility checkup. This involves a physical examination. Questions about their health and sexual histories would also be asked. Sometimes, this can find the problem. However, most times, the doctors would need to do more tests. In men, doctors usually begin by testing the semen. They look at the number, the shape, and movement of the sperm. Sometimes, doctors also suggest testing the level of a man's hormones. In women, the first step is to find out if she's ovulating each month. This is very, very important. However, here are a few tips in tracking your ovulation at home. Write down changes in your morning body temperature for several months. Write down how your cervical mucus looks for several months. And also use a home ovulation test kit. These are available at drugs and grocery stores. If you can't do any of this, download some applications on your phone to help you with it. Doctors can also check ovulation with blood tests or do an ultrasound of the ovaries. If the ovulation is normal, the doctors go ahead to do other fertility tests to find out where exactly the problem is. Some of these fertility tests include hysterosalpingography. I might not pronounce it well, but it will be written in the description box below. This is an X-ray of the uterus and the fallopian tube. Doctors inject a special dye in the uterus through the vagina. The dye shows up in the X-ray. This enables the doctor to see if the dye moves freely through the uterus and fallopian tube. This helps to detect any physical blocks that may be causing infertility. Blocks in the system can keep the egg from moving from the fallopian tube to the uterus and could also keep the sperm from reaching the egg. Laparoscopy. This is a minor surgery to see inside of the abdomen. The doctor does this with a small tool with a light called laparoscope. The doctors can check the ovaries, fallopian tube, and uterus for disease and physical problem. Scarring and endometriosis is detected by laparoscopy. Finding the problem to infertility is not found right away. I know finding the cause could be a long and emotional process. Don't get all worked up. Just be positive and hope for the best. So now we move to the treatment of infertility. Infertility can be treated with medicines, surgery, artificial insemination, or assisted reproductive technology. Many times, these treatments are combined. In most cases, infertility is treated with drugs or surgery. Specific treatments for infertility are treated based on the test results, how long the couple has been trying to get pregnant, the age of both the man and the woman, the overall health of the partner, and preference of the partners. Doctors often treat infertility in men in the following ways. 1. Sexual problems. Doctors can help men deal with impotence or premature ejaculation. 2. Too few sperms. Sometimes, surgery can correct these problems. Antibiotics can also be used to clear up the infection affecting the sperm count. 3. Sperm movement, to mention a few. In women, some physical problems can also be corrected with surgery. There are fertility medicines used to treat women with ovulation problems. These medicines has its own pros and cons, so it's advisable you talk to your doctors for better knowledge about the possible benefits, danger, and side effects. These medicines include clomiphene citrate, also known as Clomid, human menopausal gonadotropin, also known as HMG, follicle-stimulating hormone, metformin, bromocriptine, to mention a few. These drugs increases the chances of a woman of having twins, triplets, or other multiples. There is a term called intrauterine insemination, also known as IUI. This is an infertility treatment, which is also called artificial insemination. A woman is injected with a sperm, which is specially prepared. Sometimes, you have to treat a woman with medicines that stimulate ovulation before the procedure. IUI is often used to treat 1. Mild male factor infertility, women who have problems with the cervical mucus, couples with an unexplained infertility. We also have a term called assisted reproductive technology, which is also known as ART. This is a group of different methods used to help infertile couples. ART works by removing eggs from the woman's body. The eggs are then mixed with sperm to make embryos. The embryos are then put back in the woman's body. Some factors that affect the success of ART include age of the partners, reason for infertility, the clinic, the type of ART, if the egg is fresh or frozen, if the embryo is fresh or frozen. ART could be expensive and time-consuming. This has allowed so many couples who have difficulties conceiving. The most common type of complication is multiple fetus, which can be prevented or minimized. Types of ART. 1. We have in vitro fertilization, also known as IVF. This means fertilization outside the body. IVF is the most effective ART. It is often used when a woman's fallopian tubes are blocked or when a man produces too few sperms. The woman is given a drug that causes the ovaries to produce multiple eggs. Once the eggs are matured, they are removed and put in a dish in a laboratory along with the man's sperm for fertilization. After 3 to 5 days, healthy embryos are implanted back in the woman's uterus. We also have the zygote intrafallopian transfer. It is similar to IVF, just that a young embryo is transferred to the fallopian tube instead of the uterus. And we also have gamete intrafallopian transfer. This involves transferring eggs and sperm into the woman's fallopian tube. Fertilization occurs in the woman's body. It is not a common process. Also, we have intracytoplasmic sperm injection. This is often used for couples in which there are serious problems with their sperm. Sometimes it is also used for older couples or for those with failed IVF attempts. In this process, a single sperm is injected in the matured egg. Then, the embryo is transferred to the uterus or the fallopian tube. ART procedure sometimes involves the use of donor eggs. Those are eggs from another woman, donor sperm, or previously frozen embryos. Donor eggs is sometimes used for women who cannot produce eggs. When a woman has genetic diseases that can be passed to the baby, it is advised a donor egg or sperm is used. Surrogacy occurs when a woman has unhealthy eggs or produces no eggs at all. A surrogate is a woman who agrees to become pregnant using a man's sperm with her eggs. After birth, she gives up the baby for adoption to the proposed parents. Gestational carrier. A woman's egg is fertilized by a man's sperm, and the embryo is placed inside the carrier's uterus. The carrier is not in any way related to the child and gives out the child to the parent at birth. I hope this video has been very helpful in one way or the other. Don't forget to like, subscribe, and drop a comment in the comment box below. And please watch out for my next video. Thank you, bye.